Today on Dueling Doctors, we're dealing with daily struggles that you or someone you know is battling every day. From that oh no feeling of overactive bladder to excessive sweating and those horrible headaches. What causes these conditions and how should you treat them? Different doctors from the world of holistic natural medicine and conventional Western medicine square off on how to overcome these obstacles. Plus, a home remedy to reduce headaches, courtesy of my mom. It's holistic and natural versus conventional health experts with different opinions and one goal, to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the world of both conventional Western and holistic natural medicine join us to debate and discuss the best ways to treat what ails us. Let's get started by introducing our guests. On the holistic side of the equation with a specialty in acupuncture is Noah Rubenstein, and here with a more conventional approach with an expertise in internal medicine, like myself, is Dr. Carrie Peterson. Welcome both of you.
Thank you. Thank you.
Okay, first up, when it comes to daily struggles, that not so fun, often inconvenient, overactive bladder. Now, we all know that the kidneys filter the blood and it turns into urine, which is stored in the bladder, and then it gets expelled when you urinate. But something happens in overactive bladders where the brain is stimulating those muscles and you get that oh-so feeling, I gotta go, and sometimes even incontinence. Now, you know what contributes to this condition. How can you control it? Each of our experts has up to 1 minute to give a treatment plan, and then they will be given the opportunity to respond. We flipped a coin before the show to see who would go first, and Dr. Peterson, you are up first.
Thanks, Dr. Frank. Well, I approach patients in a multifaceted manner, so initially I'll try behavioral things. I'll advise them avoid excessive fluid intake and diuretics because your bladder will become too full and it's harder to hold, and keep your weight down because if you're a little overweight, it can press on the bladder and worsen the problem.
So natural diuretics like caffeine.
Like caffeine, exactly.
And what else? Soda, carbonated beverages. So stay away from that, especially at night.
Especially at night, yes.
And cut off, what's your cutoff for drinking?
For fluids, about 7 or 8 o'clock at night.
Right. Okay.
Yeah. And then I have them try bladder training techniques, and there's a few things they can do.
Will you have them run on a treadmill? The bladder itself?
No, a little different.
Bench presses.
What I have them do is when you feel the urge, try to hold out a minute or two the first time around and gradually build up your capacity to hold the bladder over time.
So a good tip, like I'm laying in bed, I want to go to the bathroom, and you say, okay, let me wait for a commercial.
Exactly.
And then let me wait for 2 more commercials. And that way you're actually building up the muscles to hold it and then
to try to train them.
Yeah, because psychologically also, every time you feel like you have to go to the bathroom, you feel compelled to go to the bathroom.
Right, because you're
actually training yourself to go. All right.
Yes. And so the idea behind the bladder training is just to increase the bladder capacity and reduce that urge.
So sort of like Kegel exercises, or is that something completely different?
Ooh, that's a good one too, Dr. Frank, actually. I love Kegels. Kegels strengthen those pelvic floor muscles.
When I think of Kegel, I think of, I'm having a baby, like, and not me having a baby, but
I know most people do associate it with women, but men can do them too.
Really?
And then for some people, for example, I had a patient call me the other day saying she had an accident in the supermarket where she had to go, they wouldn't let her use the bathroom, and she expelled right on the floor. And that's a horrifying situation.
Talk about clean up in aisle 3. I would not want to be that person.
That poor woman.
Oh.
So in someone like that, we will resort to medications that relax the bladder wall and
you talk about anticholinergics.
Yes,
so
exactly.
Acetylcholine actually works on the skeletal muscles to contract. So this blocks those, right?
This blocks the involuntary muscles.
Lots of side effects.
It can have side effects, especially in the elderly. It can cause dry mouth. It can.
Right. I remember that mnemonic: dry as a bone, red as a bee, mad as a hatter. Yeah, which is not fun when you're taking it. But sometimes you have to reserve and give a patient actually a prescription medication
for more severe cases, and they can be very
for
effective.
That patient.
Yes, for her, we definitely got started on medication.
That really affects your lifestyle. People won't leave their houses.
Yes, exactly.
Okay, and is there anything else?
There are. Then in much more severe cases, patients who really are debilitated by this, there is a device almost like it's analogous to a pacemaker to the heart. It's a little wire that's inserted and stimulates the nerve that supplies the bladder, and it can sort of override that urge to go.
But these are like
control symptoms.
Real severe cases, especially for patients who have had spinal injuries or in accidents, I see.
Or stroke.
All right, that was very good information. Dr. Noah, what do you think?
Well, those are all effective treatments when they're appropriate, and I'm all for Western medicine when it's the right thing. One of the things that we do in Chinese medicine is we distinguish between two different kinds of urinary frequency. One has to do with what we would call dampness, and that's when we see urinary tract infections and interstitial cystitis. And for these kind of things, we want to get things moving and reduce the spasms in the urinary bladder. The other are more metabolic conditions that we see for us that have to do with dribbling and stress incontinence. And so we make a distinction that then guides our acupuncture treatments and our herbal formulas.
So first line would be acupuncture.
Acupuncture would be the first thing that we would do.
All right, and is there any herbal supplements that you can offer your patients if this is just overactive bladder that's not due to something like, let's say, a urinary tract infection or bladder tumor? That's something that's just, it's the stimulus from the brain that's just giving this urinary tract.
Absolutely. Pumpkin seed
spasm.
extract is the first place that we usually start with people. And so
But you're recommending the extract in that case?
So the measured extract that you can get at any health food store. And what that does is it supports nitric oxide synthesis in the pelvic floor muscles to strengthen them and help with
Which
control.
is also very good for people who have enlarged prostates.
Absolutely.
Well. Okay.
Absolutely. Another supplement is called cleaver, and we also use that
Like a meat cleaver.
spelled the same way, but that's not what we're doing.
It's not a weapon.
It's not a weapon, and it's not a therapy for frequent urination. And so cleaver also helps with frequent.
Because it's an antispasmodic, so you're not getting that.
It's an antispasmodic as well.
Okay.
And then magnesium can be very useful.
Magnesium is
because
always
that helps
good.
relax muscles as well. And the cleaver also can help, just getting back to that, can also help with low-level infections that sometimes cause irritation that then leads to
I know
the
cleaver
frequency.
is an antispasmodic, but I do know that also it's a diuretic because I thought initially there was another treatment for edema and reducing edema. And not necessarily a bad thing to, you know, diurese, to lose your urine, but it's not something that's going to cause like overactive bladder.
It's not
will
gonna
help
cause
with the
overactive
spasm.
bladder. It's
Because
gonna
really,
help
it's a
regulate.
feeling what is overactive bladder. It's this feeling that you have to go to the
a
bathroom.
lot of the time. That's exactly what's going on.
Now with the acupuncture, is that another session that's like maybe like sort of an hour long, or?
Yeah, that's going to be about an hour-long
And
session.
how many roughly before you started seeing?
You know, we usually recommend a series of usually around 4 or 5 treatments just to see that we're making a difference and changing our strategies as we go along in case we're not having the effects that we want.
And this is a generalized, pins go where? Because I'm always intrigued.
You know, based on your diagnosis and based on your personalized diagnosis, pins can go anywhere except we're not really looking to needle around the bladder itself
Oh,
necessarily.
you want to avoid the bladder? Because I would think you want to stop it, you know.
Yeah, I would think so too.
Like, stop bothering me.
Not quite like that. A lot of the time, acupuncture involves needling places very far away from the
Very
place where a person's
interesting.
having the symptoms.
Now, what do you do when a patient comes to you and they've already seen Dr. Carey and they're like, I'm on an anticholinergic? Do you go, get off that right now?
No, we don't say get off.
I'm putting words in your mouth.
I could phrase it a lot of ways, but we don't. We work hand in hand with Western doctors all the time because we don't believe that Western and Eastern medicine are mutually exclusive.
Well, we appreciate that. All right, I think we learned a lot. I had a lot of good information from both of you. We're going to take a break now, but up next, another daily struggle that can be a huge embarrassment: excess sweating. We'll have some great ideas to dry your wet palms and to keep you from literally sweating through your clothes. Welcome back to Dueling Doctors, the show where health experts from the worlds of conventional Western medicine and holistic natural medicine debate the best ways to treat common ailments that affect us all. We're joined by conventionally Western-trained Kerry Peterson, and here with his holistic Eastern training, Noah Rubenstein. Now, we've already discussed the best ways to overcome an overactive bladder. Now it's time to address a common complaint among many of my patients and even some of my friends. No names, Eric, you know who you are. We know sweating is a natural body function. Your sweat is produced when you're in extreme temperatures to cool your skin. Sometimes you produce a lot of sweat when you're nervous. Right now I have these big sweat stains underneath my shirt. That's why I'm wearing a jacket. But hyperhidrosis is excessive sweating, and there really isn't a known cause, and it's thought to be genetic. Each of our doctors has up to 1 minute to present a treatment plan, and then we'll discuss the pros and cons of each. Dr. Peterson, you went first, so we're going to start with you, Noah. So excessive sweating. What do you do if a patient comes in and says, I sweat right through my pits and my clothes and my dry cleaning bill is through the roof?
Well, the first thing that we do is we distinguish two different types of excessive sweating, and one has to do with the body trying to vent excessive heat coming from within inside, and the other one has to do with the body's ability to regulate the skin and the pores. In the first case, when there's excessive heat, there's usually some kind of underlying condition, and this is something that we really want to get at.
Like medical condition?
Some kind of medical condition, and it's often beyond just the stress. It can be an autoimmune issue, it can be hormonal.
Okay, so what if it's just a patient like one that I've had who just sweats excessively, palms drip, there's a puddle of sweat on the floor by the time we're done with the exam, and he tells me it runs in his family. There's just no cause.
Sure. We see this quite a bit, actually, at our center. And the first thing that we do is we give acupuncture treatments, and the acupuncture isn't necessarily where there's...
It's not in the sweat glands or in the
It's not in the
palms.
sweat glands at all.
It's just a general acupuncture treatment.
General acupuncture treatment.
And how long does that last?
That usually takes about an hour, their
And
first treatment.
One treatment will stop me from sweating?
No,
or?
we usually recommend that people do a series of treatments before we begin to see
really
results.
see
We
some
want to give the
results.
medicine a chance to take root.
Okay.
And then we also prescribe customized herbal formulas. Like what? Well, Chinese herbal formulas are designed in such a way that they're administered on a case-by-case basis. But there are also things that people can get at their local health food store.
Sure.
Things like astragalus, which can help to strengthen the skin and the pores.
Now, astragalus is usually, I thought, for night sweats particularly. Is that true?
Not necessarily. No, it helps from a Chinese medical point of view. It helps to tonify the qi that's responsible for the pores in the skin.
Okay, what else?
Something like Shisandra is very commonly used because not only does Shisandra help to astringe the sweat and the pores, but Shisandra also helps to settle the mind. And even if stress isn't the reason that a person's sweating too much, it becomes a causative factor. It becomes a part of the equation because it makes people nervous.
All right, Dr. Carey, you want to jump on in here and help me with my hyperhidrosis?
Sure, I see this very commonly, and I'm presuming by the time a patient comes to my office complaining of excessive sweating that they've already tried some of the available over-the-counter preparations. So of course you would start with an over-the-counter antiperspirant, which contains aluminum, and that will clog up those sweat ducts so that you sweat less.
Yeah, so, but we're talking beyond deodorant.
And it's sort of a stepwise approach.
Yeah, antiperspirants, right.
After that, there is a prescription strength antiperspirant available that you can get from your physician.
Right.
It's used nightly. The one
You're talking about Drysol.
Drysol is one example, exactly. The one limitation with that is it's oily. So you can use it on your armpits, but on your hands and your feet, it may be too slippery. So my advice to those people is use it at night and sleep with it on, and that way in the morning you wash it off and it's already
I'm going to stay on
effect.
here for 1 second and tell you, but aluminum causes cancer.
That's actually not been proven to be the case.
But I've heard that, but it has not been proven.
It has not. There's
Have
not
you heard that?
literature to support that.
Okay. There's no literature really to support
No,
that
there's not.
aluminum per se causes, particularly breast cancer was which one of the
That's
links.
right.
Okay, so beyond that, what else could you do?
The next stepwise approach is Botox. Now, people traditionally think of it as for wrinkles, but it is FDA approved for excessive sweating in the armpit. There are doctors that will use it off-label on the hands and soles as well.
I have used it for this patient for his palms. It doesn't last very long. I mean, it lasts, what, a few months?
I've done it on many patients in my office. It's lasted up to a year in some of them, actually. I've had very positive results from patients.
It's
it
not
is
cheap.
definitely expensive. Sometimes insurance will cover the actual bottle, but it is definitely costly.
And any side effects using Botox in my hands? Am I going to get botulism?
No, you wouldn't get botulism. The one side effect in the hands is that it could weaken the underlying muscles, so it's really not often used in the hands.
Right.
And so for those people who have the hands and the feet, there's this device called iontophoresis. You can actually get it online.
Really?
It's a warm water bath.
You use the warm bath, right, okay.
You put your hands in it. It runs a mild electrical current. Don't worry, it does not hurt. You will not get electrocuted. And it microscopically thickens the outer layer of the skin. It actually works very, very well for the hands and feet.
Really?
It's just time consuming, but it really does work for people. And especially, like you mentioned, people are at business meetings, they want to shake hands.
Yeah, they can't shake hands, I know. Well, I think we learned a lot. I'm still not sure. I think I've also used sage before it, because I know it's approved in Germany for hyperhidrosis.
Exactly. And one of the effects of sage is it helps to modulate your sympathetic nervous system, which is your fight or flight symptom. And as we know, stress and that reaction plays into excessive sweating.
Okay, perfect. Well, when we come back, help for headaches, including a tip from my mom. Welcome back to Dueling Doctors, our daily struggle show. Time to talk about one of the most debilitating everyday issues, headaches. Now, we've all had a headache before. Today, we're just going to focus on tension headaches. And that's an area of the scalp that hurts like for actually minutes to up to sometimes days. It's described as a band around the head, but it's not due to muscle spasms as was previously thought. Now we know that there are triggers that stimulate an electrical impulse that gives you that pain. So, Dr. Kerry, you're up first.
It is a very common problem, and my first focus is to try to prevent the headache from happening altogether. So the main triggers are something we all experience: stress, anxiety, muscle tension, and poor posture. So the main 4 tips I give to patients is exercise regularly. That'll get blood flow to the muscles and loosen them up. Get lots of sleep, because if you're overtired, very likely to get a headache. Try to manage your stress, be it through meditation or yoga. And don't slouch at your computer all day at work. Sit up nice and straight and keep your shoulders down. But even if you try those methods, sometimes you still get a headache. And in those cases, I'll recommend an over-the-counter medication. Now, to start with, I like ibuprofen, such as Advil, or acetaminophen, like Tylenol, or my favorite, a combination pain reliever that has aspirin, acetaminophen, and caffeine. And that's something like Excedrin. And most people have success.
I just want to say, the funny thing is, most people are not going to come to Dr. Kerry with a headache, right? Because we have these buildings called pharmacies on every block in New York City, right? And you can just become Dr. Joe Schmo and go get yourself aspirin, ibuprofen on your own.
Definitely.
So by the time they're coming to see Dr. Kerry, it's probably chronic at this point.
More frequent or more severe.
And I think more so those lifestyle changes really are important that you brought up. And, and you know, one of the things I tell patients is, give your eyes a break. You're on the computer, you're on your BlackBerry, you're on your iPad or whatever. You really need to unwind and get away from that, because, as you know, these anti-inflammatories have a lot of side effects.
They can.
And what is the worst thing that when you use them all the time?
Well, for acetaminophen, you can get rebound headaches if you're taking it too frequently.
So tell everybody what a rebound headache is.
What that means is, if you're taking acetaminophen on a daily basis, when it starts to wear off, you can start to get a headache, so you take it again, and then as it wears off, you get another one.
So you're getting a headache from
cycle.
not taking the acetaminophen that you took for your headache, which is very important. All right, so the lifestyle cues is really important. Correct.
And there's preventative medications as well. Antidepressants, in fact, can work to help prevent tension headaches.
And that's linked with the serotonin, that you're not getting enough serotonin, which is a neurotransmitter, and that can be linked to headaches. Those are great tips. Do you have any alternatives? I hate saying that word, I'm not supposed to, but any other naturopathic
Any
ways?
complementary things to do with...
Thank you. Complimenting me is always nice.
Sure. and we see headaches a lot at the Inova Center. This is a really common complaint, and people have all kinds of reasons for them. And in Chinese medicine, we talk about roots and branches. The branches are the symptoms a person's feeling, like the tension headache, but we're very focused on getting to the root conditions, what's underlying it. And so in Chinese medicine, working out what the stressors are that are causing it, because a lot of the time our treatments are based on areas that don't have anything to do with the head.
So what's first and foremost? Acupuncture, which I think out of all the topics we discussed today, acupuncture is probably the best for headaches.
It's always, acupuncture is fantastic for headaches. And when we do it in the neck and shoulders, because these are often areas where there is muscle tension.
Because you're slouching, like Dr. Kerry just said not to do.
Posture, stress, people hold these things in their necks. But also we do points far away from the head.
Trigger points, actually?
Not even necessarily trigger points. Acupuncture points in the wrists and the ankles. And the reason we do this is because it helps to draw some of that stuck energy down.
So
and
one
out
treatment could actually take care of...
make a huge difference.
Huge impact,
And even though treating those points far away from the head seems weird, this is something that's worked for thousands and thousands of years, and we see it every day in our clinic.
Okay, so you're doing the acupuncture. What are some oral supplements you could take?
Oral supplements that people can take run the gamut from bromelain, which is great because it helps to reduce nerve.
It's a pineapple enzyme.
Exactly.
Right. The only problem with bromelain, and it is very good for headaches, the problem is that it's also a blood thinner, and you have to be very careful if you are on oral blood thinners if you're taking it. So one of the things I stress with all of these, which are great tips, is that you please tell your doctor, because a lot of healthcare providers don't know the complementary medications that they're taking or that they're buying at the pharmacies. A lot of patients don't tell me what they're buying on their own.
They don't tell you the supplements.
Drug interactions are really important, as are, based on what we were discussing before, over-the-counter medications, even Tylenol. People, it's a slippery slope, and people can start to take lots and lots of it, and that can bear a burden on their...
So bromelain, and then what else?
Bromelain, CoQ10 is really good to take because CoQ10 helps to reduce oxidative stress on the muscles and helps them relax a bit.
Well, you know what? I think we came to some common ground here on this topic especially. Well, that's great. We need to wrap things up, and I want to thank you both for joining us today and for all your great information. It was really enlightening for me, at least, and I hope for you. Coming up, a spin on dealing with struggles, including a home remedy for headaches from my mom. We'll be right back. Everyone struggles with something on a day-to-day basis, and whether your issue is a slight problem or something more serious, there are a lot of great medical options. Now it's time for my mom's home remedy for headaches. I love talking about my mom, Michelina, because I attribute some of my early medical training to her. Oh, there she is. She's an old school Italian and reluctant to go to the doctor and relied on many of her own home remedies, which I still use today. Here's one of her cures for headaches. You soak your feet in warm water for about 30 seconds while you're soaking cotton socks in ice cold water. You dry off your feet and you take those cold, icy socks and you put them on your child's feet. Yes, she did this while we were kids. After you get that sock on, I'm sorry, they didn't teach me this in medical school, you put on nice warm wool socks over that. And then you go to bed. The treatment acts to increase circulation and decrease congestion. It has a sedating action, and many patients report that they actually sleep much better during the treatment. However, those of you who suffer from vascular disease or Raynaud's disease, I strongly you do not do this. Do not listen to my mother. Go to your doctor. I'm Dr. Frank Spinelli. Hope to see you soon on Dueling Doctors for more healthy discussions as we explore the best path for your own personal prescription. And as always, be sure to talk to your healthcare provider before making any medical decisions. We'll see you next time.